Oh, you went quiet again.
It keeps going down on its own. Settings for selected device, and I can't find a way to keep it there. All right, I'm just going to keep moving it. I may not be elegant. Let me try it here so that I can keep moving it. It seems to be just moving on its own. Ready? Dr. Marcy, it's so exciting to have you on the show today. I wish more people were aware of this issue that you're going to talk about today before they got married and before they want to have children, because some people find it such a difficult and frustrating experience. So tell us a little bit about how could you reduce the stress in your marriage in trying to conceive?
Well, one of the things that I think people forget sometimes is that the body is an entire system, and almost like every ecosystem has a balance, the body has a balance that it needs to find as well. And one of the misconceptions is that it's easy for younger women to get pregnant and it's easy to get pregnant. But the truth is, really, most women only have about 3 days out of every month where they can get pregnant. And so when the system isn't functioning well as a whole, it makes things even more difficult. And if people were looking from the beginning at where are things not working perfectly in my life, they could figure out a lot sooner how to stave off this issue from the first. And so, talking about infertility and thyroid dysfunction, the reason I think that's so important is because most women don't even get their first thyroid panel run, even if there's a family history, until age 32. That's the first time it's recommended. And I really believe we should start checking it at age 20, after that first couple of years of stress in college and eating differently outside the family home, because those things play a role in how the thyroid functions.
I couldn't agree with you more. And it's amazing to see how many women, young women who come in, they don't even know all the things that affect their thyroid. And even when doctors order thyroid tests, they don't order the complete thing. So I want to hear from you. What thyroid panels do you think should be done and when? I mean, you
Yeah.
said 20. Should it be done periodically?
So, because the thyroid can change over time with what we call the toxic load or toxic burden, a thyroid panel should really be done every year at your annual exam, whether that's with your GP or whether that's with your OB-GYN. From age 20 on, or even from the time you start birth control on, because birth control is a drug, your liver does have to process it. The liver does send a signal to the pituitary gland that tells all the rest of the glands what they're supposed to be producing and when. So if you're somebody who starts birth control at age 14, you probably need to start having a thyroid panel run then, because that toxic burden in the liver can start building up, start affecting how the liver signals other things. So the thyroid panel that should be done is what's called the TPO, or thyroid peroxidase number. You should also have the thyroglobulin antibody test run to make sure that you're not developing an autoimmune type of thyroid condition. And then you want a TSH level, a free T3, a reverse T3, a free T4 at a minimum done every year. Um, you'll find that if you look, there's a normal range, but then if you look at the research done by Dr. Isabella Wentz, you can see that there's actually an optimal, more functional range. And you can fall in the normal range, but still not be able to have the ability to get pregnant or have a baby or carry a baby to term, because your thyroid isn't giving the body what it needs for you to sustain life. And so obviously it's not going to allow you to continue to sustain the life of something you're trying to grow in terms of another human being.
That's an excellent point. So what is the normal range versus what is the optimal range? I think that's what people get confused about, because I see a lot of thyroid tests and very rarely does anybody order antibodies. And same thing with the free T3 and free T4. But what would you consider the optimal range. Let's get out of that box of normal, because what's normal in our society is they're overweight, hypertensive, on several medications, and that's normal in our society. What's optimal?
So I have a chart here, and I'm just going to reference it because I don't want to I'll mess up the numbers in between on which is which. So let me just pull up that chart. But the optimal ranges are usually more narrow than the lab test suggests. So I believe like the optimal range for um, TSH level is between 2.0 and 5.3. Well, the more optimal range for that would be 3.5 to 5.0. And then for reverse T3, you're within the normal range if you're at 1.2, but you really need to be closer to 1.8 to 2.8 in order to have an optimal thyroid function. So you can see that the ranges for what they consider normal can be this big, but the range we really want you in is closer to only about 20% or 50% of that range, depending on the specific thyroid test that we're looking at. And there are some people who will just run the TSH test in younger people because there is some research that says it gives a broad amount of information about whether or not somebody might be, too low or too high, and they should just be able to tell from that TSH test. But what it doesn't tell you is how that is being used. And then there are a lot of cases where that reverse T3 doesn't get done. And the reverse T3 is really what your body's able to use out of all of that thyroid hormone. So if you can't convert TSH to T4 and then to T3 and then reverse T3, it doesn't matter how much TSH you have, you won't get what you need out of thyroid.
Thank you for sharing that, because I know that whenever I look at lab tests, people just stop at the TSH and that's that. But on to your liver. I mean, your liver is extremely important when it comes to metabolizing. And, I read somewhere that if you drew blood on a newborn, you'd find 200 chemicals in their body. And we're exposed to toxins all the time. Tell us about how detoxification really makes a difference with your thyroid and other hormones.
Yeah, so your liver is responsible for processing 80% of everything you take in, and that includes whatever you're breathing in the air. If you have a glass of wine or a beer or a cocktail, any medications you take on a regular basis, with the exception of some of the NSAIDs, so like Advil and sodium naproxen, or I forget the brand name of that, Aleve. So Aleve, those are processed more by the kidneys than they are the liver. But even things like your insulin, life-sustaining medications that we take, Lipitor, those kinds of things are processed in the liver. And there are some genetic markers that you can look for to see if your liver is functioning optimally. There are some blood markers you can look at to see if your liver is functioning optimally, and ways that you can support it, because there are two different pathways of detoxification in the liver that have to be functioning in order to do the full processes that the liver needs to complete in order to detoxify. So if it's not detoxing, it spends so much time trying to clear the body out of all of these things that the what we call the HPA axis breaks down. So if you think about if you're trying to water a garden with a water hose that has a kink in it, how efficiently are you going to water that garden? And the answer is not very efficiently at all. You're going to go and you're going to fix that kink in the hose. So we want people to think about their hormone balance the same way. That communication between the liver and the pituitary gland that then tells the thymus and the thyroid and the adrenals and the pancreas and the gallbladder when they need to release what they need to release has to all have perfect amounts of communication all of the time. So if you can't really detox, you need to spend a little time focusing on cleansing out that liver and working on how those pathways are supported and how they work. And one of the things I tell my clients a lot is when they are spending time waking up in the night, clock that time. And not that I want them to wake up fully and say, this is when I'm waking up and I can't then fall back asleep. But I want them to kind of be aware of when that's happening because there are clocks that happen according to organ detoxification. And for the liver in particular, if people are waking up between 2 a.m. and 4 a.m., especially if it's between 2 and 3 a.m., I want to know how they feel when they wake up. Is it I'm waking up because I have to go to the bathroom? Is it I'm waking up because I have a headache or I have pain and I need to move? Especially if that pain is centered around the rib cage or the back. I want to know those things because then I know for sure that I need to support their liver better. And that's going to help us in all of these other things that might be going on with them, including infertility.
I've been learning a lot more about clocks. I think everybody knows the circadian rhythm is night and day, but every organ has a clock. And if they're not synchronized, you're a mess. You're a hot mess. The other thing about that, I think we should talk about is pooping.
It's a funny topic, isn't it? And if there's kids watching, I bet they're laughing right now, right? Because who talks about poop, and especially on national television? But it's something that really, when you consider detoxification, how do you get rid of these toxins that have built up that the liver's filtering out? And the truth is, we do that a couple of ways. We do it through things that we breathe out. So if you have really bad breath, it might be an indication that your other systems of detoxification are not working well, or through your sweat. So if you're somebody who has sweat that's really kind of that smell afterwards where you just kind of smell a little rancid, it might be an indication that you're not pooping enough because poop, pee, it's one of the primary ways that we get literally crap out of our body. So if you can't poop, and when I say not just one time a day, the average times you should be going to the bathroom, having a bowel movement a day is no less than two, hopefully three, and optimally four. And if you think about it, about 12 hours after you eat, you should go to the bathroom because that should be the normal transit time from the time you put it in your mouth to the time it empties the bowel. So if it's taking you, if you're only going to the bathroom once a day, obviously your transit time is more than 12 hours. And what that can do is start feeding into those bad gut bacteria that don't allow us to fully absorb nutrients well. And it creates things like a leaky gut, which then puts inflammatory things into the system. And unfortunately, with the type of tissue that the thyroid is, it's very susceptible to heavy metals, it's very susceptible to molds, and it's very susceptible to other toxins in the system. And the thyroid itself cannot detox if you're not going to the bathroom. So, yes, pooping can help your thyroid.
You've covered all the bases. Everything from your kidneys to your brain to your liver, and then right down to get the crap out. Love it. Love it. So tell us a little bit more about yourself and how can people get in touch with you, because you obviously bring it all together and really take care of the fine points that most people don't get to look. Their physicians or their healthcare practitioners don't really look at.
Yeah, so I'm a doctor of physical therapy by trade. I've done this certification for functional medicine to become a certified functional medicine practitioner, and I'm a certified wellness coach. And if people are looking for me, they can obviously reach out to me just by typing in my name on Facebook. I also have a website, 5280restorativemed.com, and they can also find me on places like LinkedIn and Instagram.
Thank you so much for sharing your knowledge and expertise with us.
Well, thank you so much for the interview. I appreciate your time.
Are you happy with that? I'm sorry.